Hello everybody and welcome back to the channel. So today I would like us to talk about something I've been hearing over the years, and they call it side pain. I don't know if you've heard about it before, but some people call it side pain, some people call it konabele, and other people call it la rat. I don't know if you've heard about it before, but in this video I would like us to talk about what over the years I've come to understand that this side pain or konabele means, and what my view as a medical doctor is concerning, not only my view and a couple of my colleagues concerning side pain. Over the years, we have seen so many cases of children that are brought to the hospital very sick, looking really ill, and not because probably the mother or the parents or the father did not care, because of what they understood was going on with the child. So what usually happens from our understanding is there are a couple of things that when they happen, or a couple of symptoms that when a child has, some parents consider that this child has what they call side pain or konabele or la rat. And when they come to this conclusion, they preferably choose some forms of traditional medicine. And when this is not working, they bring the child to the hospital. Now, when they're bringing this child to the hospital, it's not like they're coming, most of the time you see, it's not like they're coming to ask for your help or something. It's like they're just coming to say, okay, I went to the hospital. So when we receive these children and you're trying to do your best, or you're trying to do your part in helping the family, you get this, there is this negative approach. The family gets to you and like, no, we know what this child has. What this child has is side pain. We are just bringing because we are brought to the hospital. Like, let it be clear that we brought to the hospital. But we don't want any injections. We don't want any form of medications. If everything you have to give, probably give oral, but we don't want any injections for the child. And this happens so many times. Many people can testify to that. This happens so many times. If you've heard about side pain or konabele or la rat before, you probably know some of the symptoms more than I do. But getting to know these parents who know about side pain and how they tend to treat it, I've tried to find out like what makes you to think that your child has this and not this. What orients you towards that direction. So most of the time they'll tell me, when you put your hand on the child's chest, you feel something beating inside. And they'll say, when you put your hand for pikini belle, you will hear how it knock for inside. That is the first thing. They say when it happens like that, that is side pain. Another one, they say, you touch this baby's stomach or the abdomen, and it's very hot, but the legs and the fingers are cold. That is side pain. Some people will say when you touch the side of the stomach or of the abdomen, especially on the left side, the child will cry, or you feel something like swollen in the stomach there. So these are the three main types that I've really heard consistently, that the mothers or the carers, they tell me that when you see this is side pain. So here I want us to, like, my view as a medical doctor, I will break these signs and symptoms down, what we think, and so that by the end of this video, when you have these kind of things and somebody is telling you it is this, whatever decision you make, you should be fully aware that there is a medical explanation to it. I'd like us to start with the first explanation for when they say when you put your hand on the child's chest, you feel something beating inside. That thing that is beating inside is the child's heart. Now, it is always beating. It has always been there and it's been beating. But when a child has fever, the child's heart can beat faster than usual. And when it's beating faster than usual, it's easier for you to feel it when you put your hand on the child's chest. So that is really just, it's a normal reaction to the fever that the child is having. Secondly, when you put your hand on the child's tummy and it's warm or hot, and the legs and hands are very cold or are cold, generally, how do we dress? we expose our fingers or our hands, and our legs are also exposed. So it is logical that my body or my chest or my stomach or my tummy is going to be warmer than my feet and my hands because they are exposed. If my whole body was exposed, probably I'll have the same kind of temperature everywhere, but because my chest is covered or my stomach is covered, I will feel warmer there than on my palms or on my hands. Now, getting to the third explanation. The third explanation is when you put your hand on the child's tummy, the child cries, probably due to pain, and you feel something like something swollen there at the left side of the child's tummy. And it is good to know that if a child has an infection in the urine and probably other and most other infections, the child can have a pain in the stomach. If the child has a real severe malaria, the child can have, there is an organ here that can become enlarged, and when you palpate it, you put your hand there, you can feel it as a mass. So most of these signs and symptoms have explanations that for us make sense. And I just hope that after this, when you have your child with this kind of impression of side pain, and you have anybody pressuring you to do traditional medicine or any other form of medicine, before making that conscious decision, that the conscious decision of taking the child to the hospital or to a traditional healer, you should be aware of at least the complications that this can bring, because whatever you're going to do, if it does not work, your baby or your child is coming to the hospital in a worse state. And earlier we bring to the hospital, the better it is, the easier it is for us to manage it properly and on time and save probably the life of that child. So I hope this has been helpful. If you have other names, if you know other names, or yes, other names of the conabella or side pain, please just put them down in the comment section. Or if you know other signs or symptoms, please put them down. This could help somebody to really understand this side pain issue better.